everyone. Welcome back to the next episode of the Grow RDH podcast. My name is Katie. I'm your host. And today we have a really exciting guest on the podcast today. We have Kelsey Gaitan. She is a dental hygienist and a myofunctional therapist from Las Vegas, Nevada. And she is going to let me interview her today. We're going to do just a little bit of a Q&A about myofunctional therapy, what it is, its connection to oral health, and how it can benefit patients and how it could benefit you as a practitioner. So as we get into it, I'm just going to give the floor to Kelsey. Kelsey, do you want to just introduce yourself and tell us a little bit about you and your background?
Yes. Hi, I'm so glad to be here with you today. I've been a dental hygienist for 10 years now, and it was through my own journey that I found myofunctional therapy, and my two children they were born with tongue ties, so that brought me down that rabbit hole and whatnot. And I've been a myofunctional therapist for over a year now. So it's just amazing what it's kind of brought me into do and bettering my patients and helping them more.
Yeah, that's exciting. So I'm curious, what year did you graduate? I was an 09 grad.
I graduated in 14.
Okay, yeah. So
August of 14.
not too far. We're pretty close. So you said you had two kids with tongue ties. Now, did you find the tongue ties? I'm curious, or was it your physician? How did that come about?
So my niece, 5 years prior, my niece was born and she had a tongue tie. And so that kind of brought me into it. I had never really known much about them before, just the little bit that we kind of dabble on in school. So that was in the background. And then when my daughter was born, because they're related and everything, I'm like, does she have a tongue tie? Does she have a tongue tie? Pediatrician was like, a little, but it's okay. It's okay. And then when she was 3 months old, he was like, yeah, she's tongue tied. Like, why haven't you fixed it? I'm like, well, I've been asking you. So then I found someone that was specialized in that and did the therapy with her, got her released. When I was pregnant with my second, I knew that he would likely be tongue tied as well. So I was already prepared for that. I already had my providers lined up, knew I wasn't going to even kind of ask the pediatrician and just go forward.
Yeah, I'm so excited. I kind of hope our conversation leads into that a little bit. And the reason I asked is because I have an older son and then a set of twin daughters. And one of my daughters had a tongue tie. And I didn't realize it until I got mastitis while I was breastfeeding. And they were like, yeah, she's not really latching. She's making do, but yeah. So I was just curious how it's interesting because I feel like there's some maybe disconnect between physicians' understanding of tongue ties, and they don't seem to take it as serious as maybe the moms do. And you're like, wait, this really hurts. It shouldn't hurt to breastfeed this much. And so I'm curious, but I don't want to tangentially get off. So we'll start at the beginning and maybe we can get into that a little bit later. But so I just want to start at the beginning of explaining myofunctional therapy for those who may not be familiar. Can you explain what myofunctional therapy is and how it relates to oral health?
Yeah, of course. So myofunctional therapy, it's working with the tongue and the face muscles, getting them to work properly. So you think in a way like physical therapy, you're working with your leg, your arm, the rest of your body, but even physical therapists, lots of times they only have so much knowledge on the jaw and exercises. So with myofunctional therapy, it's addressing those muscles specifically. And all of those things connect with breathing, eating, when you're drinking liquids, like you even mentioned briefly, mastitis. So it all stems all the way back into birth. And myofunctional therapy is addressing the root function, what's going on, and retraining those muscles to work properly. So as a myofunctional therapist, I see my patients every 2 to 3 weeks, and I give them, depending on the ages, maybe 4 to 6 exercises that they'll be practicing morning and night. These exercises take them 5-10 minutes, not very long, but even when you're starting to go to the gym and starting to work out, like you have to build up the strength and the muscular education. So they're doing these exercises twice a day, hopefully. And then after a couple of weeks, we can move on to the next step and guide them through the whole process of the therapy. So typically, I'd say like 6 months, 14 sessions is a full treatment plan with myofunctional therapy. And we work with all the way breathing a lot of times because patients may be mouth breathing, so we have to teach them to breathe through their nose. Also, they may be breathing with their chest and not their full diaphragm because our mouth, if they're mouth breathing, it's all connected all the way to our toes. So we teach them how to nasal breathe through their diaphragm and look at, are there any obstructions? Like if they're not able to do those things, then line them up with the right providers that can look at if there's adenoids that are in the way or if their tonsils are super enlarged and what's kind of going on from there.
Yeah. So it sounds from what you said, it's kind of like the exercises are progressive. You kind of have to build your way up or build strength, I guess. Is that kind of the progression of what that looks like?
So yeah, we work through the phases of the program. So I continually assess them and their progress. So if someone's been a mouth breather, then their body's kind of adapted to that problem. That problem, they can't really breathe through their nose. So we teach them to breathe through their nose, where their tongue should be to get their tongue out of their airway back here. And then maybe they're unable to get their tongue up out of that airway. So we have to start working on the small muscles. There's 8 pairs of muscles in your tongue. So that's 16 muscles of your tongue. Say that only 8 of them know how to work. So then we're starting to teach the other 8 muscles how to work gradually. And then through the process, we see, does this patient possibly need their tongue tie released? And then we're also working with them through that pre and post op therapy of that included in. So if they're getting their tongue tie released, we're seeing them before to really start teaching their tongue the movements. And then they get their tongue released, and then we're seeing them, I'm seeing them a couple days after through the process, making sure that it doesn't reattach and that they're able to use their new tongue now that those muscles weren't able to work before and now they're able to work more. So then now we're strengthening those muscles and then getting them the habituation process to where now their tongue knows where to be resting and now it's resting up there even throughout the night too.
Wow. Okay, that is so interesting. It's so progressive, yeah. And I guess if you think about like training your body, it takes certain calculated moves to get where you want to be. So I find that very interesting. The next question is, so we talked a little bit about your children having tongue ties and kind of got you interested, but what led you like to go fully in? What led you to want to get training in myofunctional therapy, and how has it complemented your work as a hygienist? Do you still work clinically?
I still work clinically. I work clinically right now 1 day. I like still being able to be in the op and connecting with the patients, and then also, being that person that can guide them to myofunctional therapy and kind of tell them more so what's going on a little bit. So I'm currently working 1 day in the op still. My experience, how I kind of got here today, personally, I feel like everybody's experience when they kind of go more into the specialties, they have their own personal experience a lot of times. So I had teeth pain. I had been a dental hygienist for close to 10 years, and I couldn't really pinpoint where the pain was coming from. I had like facial tingling, a lot of symptoms. So this was after I had had my daughter, and a lot of my symptoms were like kind of concerning to me because I was like, okay, I want to go through childbirth another time, but I want to figure out like what's going on with me first. So I went to specialists to kind of like make sure nothing was going on. I saw an ENT, a cardiologist, because I had like this face pain. I felt like my pulse was really strong in one side. I saw a dentist who specializes in Botox because I was like, okay, like I'll just get Botox. Maybe I need to get Botox. And he was like, I don't know like what's going on. Like I don't know where to put it because I don't know what's going on. So I just like sat in his office and I cried because I was like, like what am I gonna do? I thought that like I was gonna do this and it would maybe help me. And then I found myofunctional therapist, and it was a physical therapist who started specializing in myofunctional therapists because she was a physical therapist. She had her jaw pain and kind of similar, didn't have answers what to do, and then got into myofunctional therapy. So she really helped me. It lessened my headaches like so much, my teeth clenching a lot. And I was just like, oh my gosh, I can do this now. I can get certified. Being a dental hygienist, I can get certified in myofunctional therapy and I can help all of these patients that have been like sitting in my chair year after year with all these symptoms that I'm like, seeing. This has been helping. I think that you think a lot of times patients that are in our chair, their tongue is like just like there and you're like fighting it back, pulling it back. And then you see that they have all that buildup in there. So if they're able to actually move their tongue out of the way, then they could be brushing in there. And then that's just leading to an array of issues. And when that patient's sleeping, the tongue's probably just falling back into their airway. So the patient's clenching and grinding. And it was just all issues that I was having as well. And I was just like, this can help them so much.
Yeah. And maybe some, like you kind of said, like some of those patients where they have pain or they have the issues and there doesn't seem to be any etiology. We're just like, we can't help you. I don't know. So I wonder, like, what are some of the common issues or conditions that you've seen trending that really fundamentally tie back to myofunctional disorder or myofunctional issues?
Yeah, because I was frustrated. I've been in a dentist chair, like working. I saw my dentist. I'm like, I take x-rays. I'm like, this tooth hurts. What's going on? I'm going to the, I go to to get a root canal. They're like, well, I don't know if it's going to help or not. It didn't. And then all my pain was right in here. So I saw ENT. You'd think like an ear, nose, and throat doctor. And he was kind of like, I don't know. I don't know what's going on either. So you'd think like, where are you supposed to go, right? So a lot of things that patients can be looking or that they might need this is if they have a tongue tie, maybe their tongue can't move around a lot. They might not know that they have a tongue tie, and as a hygienist, you can't say that they have a tongue tie, but you can tell them like, hey, like is it hard for you to eat? Does your mouth get tired at times at the end of the day? Is your jaw hurting? Because if that, like I said, there's 8 pairs of muscles. So if those muscles can't be working, all of the muscles on the jaw are going to be picking up the slack too. And in the front of the neck, then the back, maybe because their head's pulling forward, their front of the neck's shortening. So then they're getting the headaches in the back of the neck. So do you have headaches at night? And these patients are grinding their teeth too. So that maybe their mouth breathing. Can they breathe through their nose? Do they have problems breathing through their nose? Of course, their mouth's going to just go right on open, right? That can lead to dry mouth, cavities. Then we know.
It's just, yeah, it sounds like there's a lot of different things that we see in office
Mm-hmm.
that can be linked to this. What about, so is snoring one? Is snoring, how much is snoring related to? I think that's maybe a question a lot of us have. Like mouth breathing and snoring seem to be related. Sleep apnea seems to be related. How does myofunctional therapy play a part in that?
Yeah. So you think when we're looking as dental hygienists, we're looking at a patient's mouth, we're having them open. In the back, that's your Mallampati. So you have your Mallampati score. Can you see someone's uvula? Can you see their tonsils? If you can't see it, likely their airway's pretty small. Like you kind of know right off the bat. And then if their tongue is resting low, because this one's not this that good for that, but when your tongue's resting low, you have your airway back in here, and then when you're laying down on your side, then the tongue might just be falling back in here. But if we can teach the tongue to strengthen and rest on our palate, then we're able to breathe through our nose a lot. But if you think the tongue's falling back into the throat here, or like we said, maybe they have a small airway, then that's when we get the snoring. Things are kind of moving around. And there, you're tossing and turning when you're sleeping. You're not sleeping very good. You can't get a restful sleep. Lots of times with kids too, like they may be wetting the bed throughout up to like age 6 because your body's waking up. You're not getting into that deep, restful sleep either. Adults with sleep apnea, you think we're strengthening the tongue, getting the tongue out, but then also the soft palate in the back too, getting that working properly is opening up the airway too.
And that's some of the exercises is working on the soft palate as well. Yeah. Okay. In terms of, and I'm just thinking about this for myself, I guess, but you're talking about like even children. So my daughter, the same one that has a tongue tie, she snores really bad. In terms of treating children, what age groups, like if you had the ideal, like you would want to see every child at a certain age, what age groups are kind of ideal? And then even up into adulthood, like are there any past the point of no return ages? I mean, or is it for all ages?
So it's like I see my patients ages 4 and up. And even then, I'll have my I see my patients virtually. So I'll have my virtual evaluations to see if the patient is a good candidate. Some 4-year-olds are great and some not, some 10-year-olds, some 30-year-olds. It just so varies. So I see patients ages 4 up to, I have patients in their 70s right now, with jaw pain. So you think we can teach those muscles how to work? They were like, oh, I'm too old, but we can still address the dysfunction of what's going on. That being said, I wouldn't wait until someone's 4 years old, because if you're seeing that someone's snoring, they're not sleeping good, they're not going to be growing and developing properly. Lots of times in these kids, if they're not sleeping good, that there's an uptake in the ADHD, and they're sadly enough just like prescribing meds or whatnot. But how are these patients sleeping? Like, how are their airways? So if there's a 2, 3-year-old grinding their teeth, having poor sleep, snoring, then I'd be saying, like, let's look at, don't just wait until they're 4 to start myofunctional therapy, but try to get with the airway-centered provider. So like an ENT or a dentist that has the airway knowledge. There's different directories. There's the Breathe Institute and Airway Health Solutions have good ones that you can look up. There's the AOMT, the Academy of Orofacial Myofunctional Therapy, but those have more airway-centric providers on them, because you might take them to the pediatrician, or even the ENT, and they're like, oh, like they're okay, because like you said with your mastitis, for example, times things get overlooked because these providers, they're in these situations where they're just looking at like the dire need of the patients.
Mhm.
And as mothers, we're like, but we're looking at like the whole lifespan. And they're like, well, they seem okay.
Right.
So
Yes.
I would still be trying to, get with the right providers and get
Yeah.
them checked
Um,
out.
So, and we will definitely include those links in the description box. So, if you are interested in looking those up, listeners, we will have those links below. So, Kelsey, I'll have to get those links from you, and or we'll find them online or something. So, we'll have directories on there. Also, we're going to link all of Kelsey's information if you're interested in working with her directly. She sees patients 4 and up. So, we'll make sure to link your stuff as well. If you are a hygienist, and we'll have those directories, but like if you are a hygienist, what is the process of like referring? Can a hygienist refer directly? Do we need to work with the dentist probably to refer? And if that's the case, if we're in an office that maybe this is really new, how do you suggest a hygienist introducing this into their office to really have the whole office kind of surround and support a patient through like a myofunctional therapy process?
Yeah. So, I mean, uh, as a hygienist, we can recommend them the different ways to go. We can tell them, this is what we're seeing, and with those directories or whatnot, maybe find someone in your area, or like you said, I see my patients virtually, so can help find them someone too to be get looked at. But I think as a hygienist getting involved in it, it's good when we have our team on board. The first step I would do is kind of to start taking CE courses in it and learning about it. But I would start taking the CE courses in myofunctional therapy. And so, as a dental hygienist, you can't practice, you have to check with your state licensing and everything, but you can't practice myofunctional therapy while practicing dental hygiene. So, if you're practicing it somewhere in the office, then you need to be like clocking out and actually getting paid differently because you're a different employee to that practice. Now, for me, I started my own business, so I'm my employee, I have it totally separate. So that way, if I'm seeing patients in the office as a hygienist, I educate them on what I'm seeing, as a hygienist, and then say, hey, you want to set up like an evaluation, learn more about your case, then feel free to reach out. This is what I'm seeing, and this could be what is leading to a lot of your jaw pain or your sleep issues and your mouth breathing. So you can start with that. And that being said, once you have the certification, you can start incorporating it with your patients. And when you see if they have like a tongue tie or things aren't really working properly, then you can kind of guide them in the right direction too. But really just like small steps is always good too. It's new to a lot of dentists out there as well. So even dentists and then the general public too. So just by building relationships and taking the education, I think is good for the patients.
Yeah, that's always the first. Change is hard, especially when you're maybe like when your office hasn't even heard, not that they haven't heard of it. I think we've all sort of heard of it. We're just kind of like, what is it? So, yeah. So, I feel like if you feel interested after listening to this in learning more about it, take some CEs, like she said, reach out to Kelsey. Kelsey probably has a lot of good information that, she can kind of do like a Q&A. But you are on, what social medias are you on?
I'm on Instagram mostly.
Okay. What's your handle on Instagram? We'll post it in the link too.
My handle's at myofunctional period bounce.
So we will
And
link that in the description. Yeah, no, for sure. Any other last comments or thoughts, any words of advice from you before we wrap it up?
I think just, all of us out here as hygienists, when we learn something that we're excited about, it really helps. And then when we're able to help patients, it's fun. It's fun to be learning more.
It is. It's fun and exciting. And what I think I personally like about the idea of myofunctional therapy is it really gets to the root of the problems versus just solving the problems as they pop up. And so I just love I love models like that where you're getting to the root of the problem first and sort of addressing it from the beginning. So I just love the potential that it has. And I think it's really exciting for hygienists to kind of have a new path of prevention, right? We're preventive specialists. And to me, this is another level of prevention that we can provide. So thank you so much for your time and so much for all this good information. And we will for sure share all the links that we discussed in the podcast so you guys can do a little more research on your own. So I appreciate your time, Kelsey. And for everybody listening, if you made it this far, make sure to like, share, comment, subscribe, and we will see you next Friday on another episode.